Hello, I'm Sho, and in this short video clip, I'll be talking to you about first line antituberculous drugs. What are first line antituberculous drugs? These are drugs that are used for the initial treatment of tuberculosis. And drugs in this category, there are five of them, and they are isoniazid, rifampin, pyrazidamide, ethambutol, and streptomycin. These drugs in this class combine efficacy with low toxicity, and majority of patients who have tuberculosis are successfully treated with a combination of these drugs. At first, let's quickly look at isoniazid. Isoniazid is isonicotinic acid hydrazine, and it is bacteriostatic for resting organisms and bactericidal for rapidly dividing organisms. And it acts by inhibiting the synthesis of mycolic acids. Administration of isoniazid is usually via the oral route, but it can also be administered parenterally. Absorption through the GIT is very good, but it is inhibited by aluminum containing antacids. Isoniazid is widely distributed in all body fluids and tissues, and it is metabolized in the liver by the enzyme N-acetyltransferase. Excretion is via the kidneys. Metabolism of isoniazid is more rapid in fast acetylators. However, this is of no clinical significance in patients who are on daily dosing of the drug. But in patients who are on three times weekly dosing of isoniazid, the rapid metabolism in fast acetylators may have clinical implications. It is administered at a dose of 300 milligrams once daily, and in children, the dose is 5 milligrams per kilogram. But the dose might be increased further in serious infections. Isoniazid is usually co-administered with pyridoxine at doses of 25 to 50 milligrams per day to prevent the development of peripheral neuropathy. Uses treatment of active tuberculosis in combination with other drugs. It's also used in managing latent TB, but here it's used as a single agent. Adverse drug reactions to isoniazid include hepatitis, which is the most common adverse effect occurring in about 1% of patients who are treated with isoniazid. This isoniazid-induced hepatitis, the incidence increases with advancing age, and the risk of developing it is greater in alcoholics, in pregnancy, and during the postpartum period. Peripheral neuropathy. This occurs in about 10 to 20% of patients treated with greater than 5 milligrams per kilogram of isoniazid, and it is commoner in slow acetylators, also in patients with malnutrition, in alcoholics, in patients with diabetes mellitus, and also in patients with uremia. Other possible adverse drug reactions to isoniazid include memory loss, psychosis, seizures, fever, skin rashes, and the drug is contraindicated in individuals who had previously developed isoniazid-induced hepatitis. The next first-line antituberculous drug is rifampin. Rifampin, together with rifabutin and rifampicin, belong to a group of antibiotics that are called the rifamycins. Rifampin is a broad-spectrum antibiotic having activity against a wide range of organisms like gram-positive cocci, gram-negative cocci, some enterobacteria mycobacteria, and chlamydia, and it is bactericidal for both intracellular and extracellular organisms. Rifampin acts by inhibiting bacterial DNA-dependent RNA polymerase. Administration of rifampin is via the oral route, and its absorption is delayed by aminosalicylic acid. It is eliminated through bile, but it is subject to enterohepatic circulation, and during enterohepatic circulation, it is deacylated to active metabolites which are excreted in the feces and urine. Rifampin is a microsomal enzyme inducer, and because of this, its initial half-life of about 1.5 to 5 hours is shortened after 14 days. It also induces the metabolism of other drugs that are substrates for CYP. Rifampin imparts an orange color to urine and other body fluids, and the dose is 600 milligram per day or 10 milligram per kilogram per day. Rifampin is used in the treatment of active tuberculosis in combination with other drugs, in the treatment of latent TB as a single agent. It is also useful in meningococcal carriage, in staphylococcal infections, and also for prophylaxis in contacts of children with H. influenza type B disease. Adverse drug reactions to rifampin include rashes, thrombocytopenia, nephritis, cholestatic jaundice, proteinuria, and as we mentioned earlier, impartation of an orange color to body fluids. Because rifampin is an enzyme inducer, it has a large number of drug interactions. And because of this, it causes decreased serum levels of drugs like methadone, anticoagulants, cyclosporine, protease inhibitors, some anticonvulsants, and others. Contraceptives is very, very important here. So, women in childbearing age who are not ready to conceive and who are on rifampin are advised to use other forms of contraception apart from oral contraceptive agents. They can use barrier methods, they can use intrauterine contraceptive devices. Rifabutin. Rifabutin, as we mentioned earlier, is a rifamycin. It is used in the treatment of tuberculosis infected HIV positive patients who are treated concurrently with protease inhibitors because rifabutin is a less potent inducer of CYPs, less potent inducer of CYPs. That inhibitor should be inducer, not inhibitor. Rifampicin has a longer half-life than the other two drugs, that is rifampin and rifabutin. And because of this, it can be administered just once weekly. And it is used in the same situation that rifabutin is employed. Ethambutol. Ethambutol, the mechanism of action of ethambutol is by inhibition of arabinosid transferases, which are involved in cell wall synthesis. It is administered orally. It has a half-life of about 3 to 4 hours. Metabolism is via the liver and excretion is via the kidneys. Ethambutol suppresses the growth of most INH and streptomycin resistant tubercle bacilli, and resistance to its use develop very slowly. The dose is 15 to 25 milligram per kilogram per day, and it is used in the treatment of tuberculosis. Adverse drug reactions. The most important adverse drug reaction to ethambutol is the development of optic neuritis with decreased visual acuity and loss of ability of the patient to differentiate red color from green color. And because of this, it is contraindicated in children younger than 5 years. And patients who are on ethambutol are advised to have regular eye checkup. Streptomycin, streptomycin is another first line antituberculous drug, and it acts by inhibiting protein synthesis. It acts only on extracellular bacilli. It was the first clinically available effective drug for the treatment of tuberculosis, but now its use has reduced drastically, and it is now it is now um, it is now used for patients with severe forms of diseases, e.g., patients with tuberculous meningitis, patients with disseminated tuberculosis, and also in tuberculous infections that are resistant to other drugs. The dose is 50 milligram per kilogram per day. And adverse drug reactions to streptomycin include ototoxicity and nephrotoxicity. Pyrazinamide is a synthetic analog of nicotinamide, and it is active only at slightly acidic pH. It enters macrophages to kill microbacteria inside the phagocytes, and it acts by inhibiting the synthesis of mycolic acid, just the same way, just the same thing that isoniazid does, inhibition of mycolic acid synthesis. Pyrazinamide is administered orally, having a half-life of about 9 to 10 hours. Metabolism is in the liver and excretion is via the kidneys. And adverse drug reactions include hepatotoxicity, nausea, vomiting, drug fever, and hyperuricemia. The dose of pyrazinamide is 15 to 30 milligram per kilogram per day as a single dose. Thank you for watching. I have some practice questions and their answers for you at the in the last 4 slides of this presentation.